Safer medication delivery, bedside medication verification, BMV. One of the most difficult and dangerous procedures in a hospital is the simple act of delivering medication to a patient. Giving the wrong medication or wrong amount by the wrong method or at the wrong time can have serious or fatal outcomes. But the key to correct medication delivery cannot be based on asking a healthcare provider to remember better or think harder. At Emmanuel St. Joseph's, the key to this process is eliminating the opportunity for human error.
The purpose of our project was driven 100% by patient safety. We were looking to deliver medication safely to the patient. In fact, when we presented this to the staff, we made a point of saying this is not a time-saving process. This is not to promote efficiency. This is absolutely 100% about safe patient medication delivery.
A new tool for improving the process.
We use a Meditech system for our documentation, a computer system, and the medication management team, some of the members of that team went to a user conference, a Meditech user conference, and it was demonstrated there, the whole product of bedside medication verification, barcoding all medications, barcoding the patient's wristband, and they were very enthusiastic about it and brought the idea back to the administration here, and they very quickly grabbed onto the idea, were supportive right from the start.
Bedside medication verification, BMV. Technology and software to track and document the type, amount, method, and timing of any medication given to a patient.
Well, our project included, we wanted to barcode all medications and barcode all patient identification in the inpatient setting. We did leave out the outpatient settings, the emergency department, dialysis, same-day care. It was only inpatient medication, so that all inpatient med delivery would be done via the BMV system.
Bringing the tool into action.
The original framework for the BMV system came from Meditech. We had it like a skeleton framework, but we had to adapt everything to our individual hospital, to the units within the hospital. So from that framework, our group, we first of all selected a group that was interdisciplinary. There were nurses, nursing administration, information technology, pharmacy, and all of us worked together to put together a system that would work for our individual hospital and the individual units in our hospital. The challenge to train and present this to nurses was huge. So a success was that we, the members of the BMV work group, individually trained nurses in groups of 12. And we brought them into a hands-on learning setting for 3 to 4 hours. We had test BMV medication and patients set up, and they could use a hands-on training session, and we trained 350 nurses in a relatively short period of time, and it was very successful.
Success in action.
We, for instance, put all our IV bags in one area, and they're all identified, and an IV that has gone, she needed an IV very quickly and went to grab the IV, took it out of the right box, and it was the wrong IV that had been put into that box. So she said, she came back to me to tell me this. She said, I'm scanning and scanning and it wouldn't take it, and she thinks there's something wrong with the computer. Finally realizes that she has the wrong IV solution, and the BMV would not let her give that solution.
Only as good as the people who use it.
The primary success has to be that currently we are 100% BMV medication delivery in all our inpatient units. So the goal that we started out with has been met. Now the past 6 months we've really been focusing on monitoring the scanning statistics, because now we have the system in place, but it's only as good as the people who use it. And there are ways to bypass the system. You cannot scan the medication, you cannot scan the patient. So we've really been focusing on monitoring the data that shows us how often medications are being scanned. And over the past 6 months, we have been over 90% or more. And in fact, the statistics for September show that 94% of all nurses in our hospital scanned at least 90% of the meds that were given to patients. And for some of these, there was a nurse on second floor who scanned over 400 meds in the month of September, and she actually scanned 100% of those 400 meds. It has benefited our safety. Anytime you can take the human factor out, you will minimize error.